This is my 6'4" client. We have other videos showing how we treated his pelvis, and called left lower windswept pelvis. And now we're going to focus on your neck. Can you describe your discomfort? And I guess you had lots of chiropractic adjustments to your neck.
Yes.
Did the neck ever feel right?
There was some things that they helped. But there's always still just been a tightness from my shoulder to my neck. And then loss of range of motion looking to the left.
Yeah, yeah. And can you show us how it's uncomfortable when you rotate your neck?
Right. It's above the tightness, and as I come down here, I can feel sharper pain.
Okay. And do you have more rotation to the right?
Yes.
Yeah.
Small.
And then when you go right and make a circle, is that good?
Yeah.
Okay.
That doesn't hurt me.
Very good. And then can you turn around, and is there one local place where it's most uncomfortable up there?
Yeah, there's tightness.
Okay.
Here. Across to the shoulder. And then, pain is above that.
Very good. Alrighty. Now your first rib is right here. Okay. And what we found when he was on his back was we found that he had no forward spring mobility of that rib. And what I do is I put my fingers, if you'll capture this, I place my index and middle finger under that rib, and I test the third rib, and I spring it up, and then I come to the second rib, and then I come just below the neck and to the right, and I tried to create movement in the right rib, but it was not moving. And the other side moved beautifully. Okay, so I'm going to restore movement in that rib, and basically what I do is I elevate at the tubercle of the first rib. I just lift it up towards the ceiling, and then I push on his shoulder, capturing the front of the shoulder blade, and I push that outward, and I maintain that for 2 minutes. And that's usually very effective in restoring that first rib mobility. So I will do that treatment to him. And I'll show you a self-treatment. And a self-treatment for that rib is to use a hard ball. And you can do this once a week to make sure that moves. And you put it in that thickest part of that trap muscle, and then you just wiggle around making circles, searching for where you feel tightest. Okay? And then you just lay on that on the floor for 2 minutes, and then you walk along the clavicle, and then there's a bump, and that bump is the front of the shoulder blade. It's called the acromion. So you push on the acromion, and you can see that I'm pushing at a diagonal angle. Okay, so my finger is showing the angle. It's a 45-degree lateral and up.
Okay.
Okay, and you do that for 2 minutes, and that will maintain the mobility of that first rib. Okay, I would have you do this once a day for a week for 2 minutes, and then do it once a week forever. Okay, so go ahead and lie on your back.
Same way you were.
Head up here, yep. And the way to find that first rib is you pinch the thickest part of this trap muscle. And I can feel my finger and my thumb. You know, if there was no muscle, they would touch. I can feel soft tissue between them. So with my middle finger, I come below that, just below that, and that's that first rib. You with me?
Yeah.
All right. And there's no upward spring mobility, but when I come down and lateral to rib number 2, boom, we have motion. Okay? And then I come down to rib number 3, nice motion. Okay? So I'm going to prop that first rib up, and I'm actually going a little bit laterally, a little bit towards my chin, about a 20-degree angle. I'm lifting up and over to the right slightly, and then I feel the clavicle, and then there's this bump up here. Okay, there's a little step up, there's a step down going from here down, and when you come up the clavicle, you'll feel it climb up a little bit. So I capture that acromion, and again, I'm pushing it 45 lateral and 45, and then actually 45 up. This angle, 45 oblique.
Okay.
Okay, so I do this for 2 minutes. So we can stop filming now, and then we'll film the results.